You're listening to Heroes of Healthcare, a series about the bold, selfless, and innovative individuals who are serving our communities with compassion and care. This episode is sponsored by Jackson & Coker Locum Tenens. If you are seeking interim physician or advanced practitioner coverage at your facility, or are a practitioner who is looking for more work-life balance, visit them at jacksonandcoker.com to learn more about their services. Now, let's get into the show.
Welcome to the Heroes of Healthcare podcast. I'm your host, Tim Fisher. Today, we're joined by Carey Goryl, CEO of the Association for Advancing Physician and Provider Recruitment. Carey does an incredible job articulating what a physician recruiter is and how this role impacts communities all over the United States. We're honored to have Carey join the show. Well, welcome to the show, Carey.
Thanks for having me.
You bet. We're excited to have you on the show, excited to talk about what you do, what your role is at AAPPR. And I thought we would start our conversation today with a little background of who you are, like where you grew up, how your childhood shapes your leadership style, a little bit of that. So give us a little update on Carey before we jump into AAPPR.
Okay, well, this should be easy enough to talk about. I was raised in Detroit, Michigan, and grew up actually a part of the time in the city, then eventually moved out to the suburbs. I still have with me my two parents. I have a younger sister. I grew up with cats, became highly allergic to them when I was 17. And so my junior photos, oh my goodness. Oh, it was a terrible time, not understanding what allergies were at the time.
Now, was it your junior photo or your senior photo?
Well, I had to think about that. It was my junior photo. Thankfully,
Okay, well, that's better.
Yes. And when I think about who I was, who I am today, I was thinking about what stories to tell you. And one of the things I wanted to share is I'm a big thrifter. Sometimes in my presentations, I even like to say that I'm a competitive bargain shopper. I love the hunt and the thrift. And when I was growing up, it was really common for us to go to garage sales and thrift stores. And I picked up some really interesting books. And there was two I wanted to share with you. Way back in the day, I picked up a Myers-Briggs book. I think it's like one of the original editions of, are you an introvert, an extrovert? Are you an intuitive? Are you a sensor? And I think I was 13 at the time. And here I am taking the Myers-Briggs test, which of course they would say, don't take it in your adolescence. And I've taken it a number of times since then. But I learned so much about myself at the age of 13 that helped me get really comfortable with who I am. So one of the things that I learned, and this is not uncommon, is that, I'm one of those introverts who acts like an extrovert, right? I'm not shy. I can be outgoing. I just need a lot of downtime in between those moments of outgoing. So, that was just really helpful for me to understand. The other book I found maybe a couple of years later was a book about self-hypnosis. And I learned how to hypnotize my friends, how to hypnotize myself, which I always thought was just, deep, relaxing, meditative, again, and all of the angst of adolescence. I thought I really reflect back on how I found a really helpful tool that I didn't know at the time, but was really helping me find some groundedness. And I still meditate today. I still lean into my Myers-Briggs. I love thrifting. I love being frugal, and you never know what you're going to find at a thrift store.
That's for sure. So you learned a lot of really good life lessons at 13 years old. So I wonder, how has your Myers-Briggs changed? How much has it changed since you were 13?
It has changed, or maybe perhaps clarified. One of the things I learned in my 30s, I've always tested as a ISTJ, sensor, thinker, judger, introvert. And what I realized was so much of the leadership roles that I've had and still do require me to lean into almost there's this expectation that you need to lean into this data and what I can feel, touch, measure. And later I learned I'm actually much more of an intuitive decision maker, but dare I open up the gender differences of leadership? Women can be dismissed if they're leaning too much publicly into their intuition. So I think, by the messages that I was receiving, sort of downplayed intuition, although I was always a big fan of, I listen to my gut, and you always got to listen to your gut. It's a good feeling. My introverted self would say I would take in a lot of data. I would think about it. I'm not one who, is always the first to speak or first to answer a question. I really like to think about the options, which, leans into my being very strategic and purposeful and thoughtful in my leadership. One of the things I was going to say is that how my Myers-Briggs has changed, I've become more intuitive, because I feel like since adolescence, everyone's standing in the line. And they asked for a volunteer to be the leader. And I didn't quite get that everyone else around me took a step back. And so whether it was, from really like minor introductory things of, being the captain of the dance team, to being the president of the sorority within a year of joining, and so on and so on and so on. I've really written my own path in so many ways. And I always find myself in the leadership role that eventually, by the time I got to my mid-20s, I just embraced it, fell in love with it. And I've been in these leadership roles, and it's my sweet spot.
It is your sweet spot. And as you know, I have a ton of respect for you, and I think you're a fantastic leader. So when we have guests on the show, I always like to talk to them about their upbringing and their childhood, because I do feel like that's a lens that we look at the world through, and it shapes us. And it's always interesting to see how we change or clarify as we have more life experiences. So thank you for sharing that part with us. And now I'd like to move the next step. Okay, fast forward. You grew up in Michigan. You learned a lot about yourself at 13 that a lot of 13-year-olds don't. You had a great junior picture. It sounds like we'll have to see a copy of that at some point. Here's a question for you. Was the senior picture better? Did you learn from the junior picture?
I did. I definitely learned.
Okay. I feel better. I was worried about the senior one. So now fast forward, you graduate from college, which that was in Michigan as well, Wayne State. Is that correct?
That's right.
Okay. And then you get into the business world, or you get into the adulting, as we call it. Walk me through how that worked.
Yes. Probably in my junior year of college, I was going to be a police officer. Consider me, feisty. And kind of late in the game, I realized police work wasn't going to let me solve society's problems in the way that I thought was going to be most helpful. And I switched over into social work. and I graduated with a degree in social work. And one of the things that I did is I was working at a domestic and sexual violence shelter crisis line. I did case management for the shelter. I answered the 24-hour crisis line for domestic violence, sexual assault, and suicide. I surely interfaced with the police quite a bit. I interfaced with health systems and hospitals because I would respond to victims who reported to the hospital, and I would go be their advocate, and I'd be on call. And so, I got exposed into healthcare, exposed into crisis response. And so much of that experience, when you go into social work, you have to decide, are you going to work with patients, clients one-on-one, or are you going to work with communities? And again, I was one of the small population that said the community is where I need to work. I want to work at the systems level, the grassroots level, and it's really how I walked into nonprofits, because I was working at that shelter for such a long time. I wrote a grant in grad school. It was part of class. You had to write a grant, and if you could find some place to submit it to, even better. And so I wrote a grant for the class, and I found a local community foundation, and it got funded. And it became my first adulting job, where I was the grants manager and volunteer coordinator at that shelter that I had been working at for so many years. So, long story short, I decide I need to be in Washington, D.C. That's where the change happens, right? I need to get to D.C. and I'm applying for jobs. Nobody is calling me back. And this is in the early 2000s. And my husband, my new husband at the time, was into sales. And he says, Carey, we just need to get in the car and go to DC and hand deliver your resume. What? Okay, let's do it. And so at the time I had this 1994 Crown Victoria Burgundy. If you can imagine, the old cop cars. And this thing was like a boat. We drove from Detroit to Washington, D.C. in this boat of a car, right? First time ever going to D.C. I've got paper resumes and I have it might have been Yahoo Maps at the time, right? Because you had to print it out ahead of time of all these nonprofits. I was going to walk in the door. And it was rejection after rejection after rejection. Most of the places had so much security that I had no idea. I couldn't even walk in the door. And I'm like, this DC thing is not working out. Well, maybe I will try Maryland and Virginia. And so I called up the Maryland Coalition Against Sexual Assault. And I'm like, hi, I'm Carey. I'm amazing. I do this work and I'm in town. Can you, would you be willing to talk to me for 30 minutes for an informational interview? And this woman, Jennifer, she said, sure. How about tomorrow? What? And I walked out of there with a job. And 2 months later, I moved to not quite to Washington, D.C. I moved to Annapolis, right outside. And that was like the snowball that just led me into, I eventually worked at the International Association of Forensic Nurses. At the age of 29, I became a CEO with no staff and a very small membership association trying to impact healthcare's response to violence, not a small mission. I did that for 10 years. And then I came over to where I am now with physician recruitment. That's
a fascinating story. So a little bit of a side trail there. So as you're doing social work, you're in the nonprofit world, you're in an area where you're helping people. How you saw a lot of things in those roles, I'm sure, that were just eye-opening and that human beings should never see. How did you guard your heart? How did you care for yourself as you were caring for others?
Okay, those are two different questions. One, I will say, I don't think I guarded my heart. It is too easy to become bitter, angry, and to wall that off it walls off the bad, but then it can also wall off the good parts of the heart too. Like you don't get to pick which sides of the heart get walled off. So I will say I did not try to guard my heart. I certainly didn't watch Law and Order or any of the shows about, rape and murder and domestic violence. Those were not my entertainment choices. That's what, those were boundaries that I had. But the satisfaction of, on an individual level, to be able to just for like maybe 2 hours, guide someone through the worst day of their life, maybe a day where they didn't even think they were going to live. And in my presence, being able to witness, to support, to listen, to help prepare what comes next, because a person's whole life is changed after a traumatic incident like that. There is so much hope that gets refilled in the heart, despite like the horrors of what, people do to one another. The hope, it outweighs the bad. Not to say that there weren't hard days, but it does.
Sure. And that's the way you said it is a much better way than the way I phrased the question, because I'm always fascinated, because I think, like, I don't know if I could do that. And because you saw what I would only call evil at work, and you see that. And when I say guard the heart, I'm fascinated how but I love how you answered that. You opened your heart to help others, and you were there at a critical time in their lives. So, I mean, that's incredible. So now let's first of all, thank you for doing that, because we need more people in the world. My wife is a court-appointed special advocate in the foster care system, and that's why I was kind of asking that question, because we talk about that quite often. You're investing in other people to help them, as you said, on their worst day many times, and that we need more people like that in the world. So let's fast forward to now. You're Chief Executive Officer of AAPPR. So you have an incredible job. And first of all, can you explain a little bit for our listeners? And a lot of our listeners are in healthcare, but some are not. So can you share what your organization is and what your mission is?
Well, our mission is to empower industry experts in physician recruitment, onboarding, and retention through research, networking, and education. We're an educational organization for people who do the work of physician recruitment, onboarding, and retention. I'm sure a lot of the listeners are familiar with associations. They are ubiquitous. If you're in healthcare, there is an association for nearly every single job position that is in healthcare, whether it's a physician specialty or nursing or tech or maintenance. I mean, we laugh in the association world because there is an association for everything, for everyone. And physician recruitment aside, even to a little bit of extent for a pause, healthcare aside, associations are how wide scale change can happen in an industry or a profession. Some people think, well, maybe it only happens in lobbying and it's only on the government level, or, maybe it has to happen in college because you got to get a degree in something. But associations fill this void between what happens after college and what happens on the job. And the beautiful thing about how I connect my leadership, my background in social work, and wanting to address systems is that associations bring all these people together. At AAPPR's case, we bring competitors together. Recruiters in one organization recruiting for the same physician position that another hospital or healthcare organization is recruiting for. And yet we bring all these people together. We find out what are the common challenges. And my job is to figure out with the members how to do that. And so much about what I do is change management. That's really what I'm in the business today. It's change management. And the topic that I'm most invested in right now is how do we help health organizations through our members, physician recruitment professionals, to find the best, most qualified candidates as quickly as possible and help organizations have diverse forces, that they have retained workforces, and that, while our members are not the sole decision maker, sometimes they're not even a primary decision maker, they are key influencers within their organizations, and they have such an eye into their organization because they talk to so many candidates. They talk to so many hiring managers about, well, why did the last person leave? Or what's your growth strategy? And then during that process, they have to talk with credentialing and IT and finance and the C-suite, and you name it. Physician recruitment are trying, in order to get a candidate to start and be able to see patients and provide care, the physician recruitment in-house is touching all of these facets of their organization to make this happen and, make sure that patients can be seen by this new physician or nurse or advanced practice provider.
So the Association for Advancing Physician and Provider Recruitment, AAPPR, a lot of Americans may think, well, I go to the hospital and there's just always doctors. There's tons of doctors everywhere. In reality, that's not the case. Can you share a little bit why it's so, the why behind why it's so competitive for these physicians and providers?
Many people in our space know that we have a shortage today and a growing shortage of physicians. You can look at the American Association of Medical Colleges. They update their statistic every couple of years. I think right now, the worst case scenario in 10 years, around 124,000 physicians short. We have not only that, but an aging patient population. And as the population ages, it tends to require more frequent health interventions and support. So then that adds the same thing that our patients are aging, a large segment of our patients are aging, so are our physicians. And our physicians are getting closer to retirement. And then you look at the supply of people coming in, and I'll say I share concerns with a number of other people that there aren't enough people interested in becoming a physician, that even sometimes physicians themselves no longer recommend it to their children or their family because of the strain and the stress and in a lot of cases, the complete lack of mental wellness and balance that a lot of physicians don't tend to experience. And they certainly have less autonomy than they had in previous decades because fewer and fewer have their own private practices, although there aren't as many private practices because the strains of having a private practice were becoming all the more intense. And then you add medical debt, which is another reason why people may be hesitant or not enter the medical field, is because of the hundreds of thousands of dollars of debt. That there are a few programs, federal or even sometimes some employers, can help alleviate or pay off some medical student debt, but it helps if you know going into it what program you're going to use to know if you're going to qualify for any of those programs, or cross your fingers, you find an employer that you're willing to stay at, right? There's always going to be the catch that you have to stay at that employer for a period of time in order to have any debt paid off. Those are just a lot of obstacles, not overcomable, but certainly a lot of obstacles that in present day and in the future do today. I mean, patients, anyone listening might experience that it takes 6 months to schedule an appointment that isn't urgent. We need more physicians. Case in point.
Yes. Yeah. Healthcare is certainly evolving. And your member organizations are all over the U.S., all the different geographies, right?
Yes, all over.
And I would assume if I'm a physician recruiter in North Dakota, probably different challenges than if I was in Boston.
Correct. Every community, even a healthcare organization to organization, will have different challenges.
So the physician recruiters who are members of your organization, what are some of their biggest challenges within this evolving healthcare system with the landscape, the aging population, with all the different variables? What are their biggest challenges?
Well, they're still working in healthcare. That is one of the slowest industries to change. And there is a lot of legacy thinking. Healthcare has become so complex that there are so many silos. There are so many rising expectations of patients. And healthcare, I don't know if we as a society have actually agreed. Is it a for-profit business or a nonprofit business? But by and large, most health organizations have very slim profits to reinvest in infrastructure, unless it's going to generate more profit so that it can be reinvested into other growth areas. You know, the other thing that our members struggle with, you know, in addition to just healthcare being a complex organism, is that there isn't always a physician in at the time that you need it, right? There's always like a timing thing of this community needs this physician at this time. And trying to have that magic line up when the stars align, it's a wonderful thing when it does. So much of what happens in recruiting for physicians is that physicians want to work in very narrow specialties. It's almost like a specialty within a specialty. Right now, what a lot of healthcare organizations need is, I know this might sound paradoxical, but they're looking for a generalist specialist. They just need a urologist who will practice generally in urology, cardiology. I mean, you name it, neurology. They're looking for generalists in these specialties. That tends to be a really difficult pain point, in addition to just specialties that have a shrinking pool of people practicing in those specialties.
Absolutely. We just don't have enough physicians in this country, let alone all the subspecialties of the specialties. And we just don't have enough good quality physicians. And I think a lot of times people don't realize that. And I know before I got into this business, I didn't realize the shortage that you just spoke about. So it's incredible. So let's talk about your members. So they're physician recruiters. We have a lot of our listeners tell us that they listen to this podcast on their commute. If there's a little girl or a little boy sitting in the back seat and listening to their mom or dad listening to this podcast, why would you tell them? Well, first of all, could you explain a little bit about what is a physician recruiter? Because if somebody's a little boy or a little girl and they say, hey, I want to grow up and be a physician recruiter, that would be great too, right?
That would be wonderful. That would be wonderful. A physician recruiter, any type of recruiter, they look to match the best person with the best position. Now, in my world right now, the recruiters represent the healthcare organization. And so these physician recruiters know their organization's culture, its mission, its goals as an organization. They know about the patients that their organization serves. I mean, it's wonderful I've heard a number of stories about say that there's a cardiology or a surgeon position that's open, and maybe the position's been open for longer than anyone feels is comfortable. But this physician recruiter sources and reaches out and finds that person that this is a perfect fit for and who's willing to make that move into this organization. And so many times there is this scary but beautiful story of, an accident that happens, a health emergency, like a car accident or a natural disaster, where prior to that physician being hired into the community, that was a vacant position of which they didn't have that expertise. And a very, dire things happen for a person, and they get seen by this physician who, always in these stories, the physician saves the person's life. And now, granted, that physician recruiter didn't have a direct connection to saving that person's life, but there is it's that domino effect. It's that step by step, how you pay it forward, how generosity just tends to move through people. I know it's their job, but physician recruiters will feel just the utmost pride in being able to say, you know what, I was a part of that. And that feels really good. So if you're getting into this work, or if you're going to be a physician or a nurse or a physician assistant, sure, there are stresses. Every job has its strains, but the rewards can be just so magnificent.
Well, I would argue in the example you just used, the physician recruiter had a huge part to do with that. So if I'm in a rural community like I grew up in Illinois, the physician recruiter is recruiting physicians to that rural hospital where when the physician graduated from med school, they probably didn't even know that town existed. And the physician recruiter makes an impact on the entire community.
Yeah, especially in those rural or underserved communities where the physician recruiter sometimes is a bit of a salesperson, and trying to connect what a person values and what they're looking for in a job or what they're looking for in a community, and connecting that maybe to a community that they've never heard of.
As we wrap up here, just a couple more questions as we wrap up. So if I'm a physician recruiter, I know you're a student of leadership, and I see that you post on LinkedIn and you're posting about leadership, and I love following you. As physician recruiters in these hospitals or healthcare organizations, the impact of leadership within the hospital or healthcare organization impacts how happy and satisfied the physician recruiters are as well. So leadership, we think healthcare or hospital isn't a business. Well, it is. And leadership matters within that setting as well. Can you talk about, just from your members' standpoint, the importance of working somewhere that has a good culture, that has good leadership, and how that helps burnout or just mental health?
I will say leadership exists at many levels. And there are many opportunities to demonstrate good leadership. And I say that because healthcare can be a very, like I said, big, complex organization that sometimes, if the culture has some challenges, I wouldn't want anyone to feel defeated that it can't be changed. Right? That great quote by Margaret Mead about it takes a small village. Pause. I did not get that quote right.
So, Carey, I know you're a big leadership fan, and you study the leadership of a lot of different organizations. How does leadership culture affect the members that you represent, the physician recruiters? We think of hospitals and healthcare organizations maybe not as a business, but you need leadership and culture everywhere. Can you share a little bit of your feelings on that?
Yes, you do need leadership at all levels. And I think it's really important for anyone within healthcare to know that even on small levels, they can embrace good leadership qualities and make an impact, even if it's only on a small number of people. Healthcare organizations are large and complex, and it may feel daunting to try to change culture widespread. And really that is the role of the CEO and their executive team to filter down what qualities of the culture that they want to support. And likewise, it is the responsibility of everyone in the organization, frontline, middle, back, wherever you are, to also demonstrate good leadership qualities. In physician recruitment, a lot of times the teams can be small, 2, 3, 4 usually is the average physician recruitment team. They can be larger. They can be up to, over 100. They can also be a solo person. I would say that leadership, even at the physician recruitment level, so that the job itself of physician recruitment is worthwhile and feel supported. And despite the challenges, you come in day after day, ready to tackle the challenges again. It's important at every level within the organization.
Absolutely. Leadership always matters, and little things matter. So we've had roughly 80 episodes of Heroes of Healthcare, and we end each episode with the same question from our guest. So who is your hero?
My hero. I have a number of them. When I think about heroes, I think about, their courage, that they do the right thing when no one's looking, that, they're working for the common good. So in this case, I'm going to give a shout out to high school and middle school teachers, kind of as a group. And I'll say my husband was formerly a high school teacher and still works in high school. And I think that they are heroes every day. They are educating a very challenging segment of the population at a time of a lot of change, that I don't know how many are reading self-awareness books and who themselves have their own pressures. And I think about at the high school level where violence is becoming more and more, it feels like it's becoming more the norm, that these teachers are putting themselves in situations that may not always feel the safest, but they really do come from a good place and a good heart to stick with these kids when they are emotionally dynamic. And
that's a good way to put it.
Right? You like that? I just made that up.
That was good.
And I think they deserve to be the next heroes.
Well, those are great heroes. And both my parents were teachers, educators. And I grew up in a family where I saw what I felt was underappreciation for the impact that they were making on young people's lives. And I completely agree with you. And to your earlier comment about the shortage of doctors in the United States, there's a serious shortage of teachers in the United States as well. So I love that you highlighted that segment of our society that makes such an incredible impact on all of us, because most of us went through middle school and high school too.
And then we did. Or we have kids going through it. Oh, we all survived.
It's rough. I'm not sure if it's rougher to go through it ourselves or to be a parent, right?
Yes.
Exactly. Well, Carey, we are honored to have you as our guest, and thank you so much for your time today.
Oh, thank you so much for having me. It was a pleasure.
You've been listening to Heroes of Healthcare. If you enjoyed today's episode, please tell a friend or leave us a review wherever you get your podcasts. You can also visit us at www.heroesofhealthcarepodcast.com for more information or to listen to past episodes. Thanks again to our sponsor, Jackson & Coker Locum Tenens, providing interim physicians and advanced practice staff for over 40 years.